There are two basic things in every human life: health and education. Many people across the world are not getting the health service and the health prevention, the vaccinations, immunizations that they need.
In order to achieve universal health coverage anywhere, it is fundamental to have presidential leadership. President Kikwete is a very esteemed former president of Tanzania, has made massive progress on maternal and child health in Tanzania, and he has agreed to help us mobilize the support of heads of state across the continent of Africa.
Getting access to healthcare is a basic human right. To see people denied this basic human right is something that I don't want to see. I'm a believer in the aspirations or objectives of UHC. You know, there are people out there who die of causes which can be prevented, diseases that can be cured, but because they live in a setting of weak primary health care systems, access becomes a problem.
The role of the campaign is to amplify the leadership that already exists on the continent. The name itself is One by One Target 2030, and the idea is one by one, all 55 countries in Africa signed on to UHC by 2030.
Of course, we're working with the African Union, and through the African Union, we'll be able to reach out to the leaders.
The debate about universal health coverage is a very important one. And us in the African Union Commission, we are working on the implementation of Agenda 2063, which is our strategic framework in the African Union. It has to be for helping us on building our capacity, on gaining the knowledge that we need to gain, and to make sure that we are doing it ourselves, because this is part of the sustainability we are looking for.
One has to realize that to have a system that reaches all, you must build it upon solidarity.
Tonight we honored countries as they take the necessary policy steps to UHC: South Africa, Ethiopia, Mali, and Kenya.
Getting it right with health can't happen without looking at the whole piece. Improving the lives of our residents cannot happen if each resident, each person cannot have access to healthcare. Why does universal healthcare matter? It matters because it's at the heart of improving the existence, the lives, and the potential of our residents, and that's why we're here.
If we want to reach the universal health care goals, we have to make sure that we deliver on the health needs for women and children.
That means that mothers stay alive, they're able to take care of their children and their families. That means ensuring that the entire community can have access to primary care.
We are all humbled to take a lesson from the young people in Africa who understand the way forward.
Young people are the future. If we can get the young people involved, then the whole campaign has a bright future.